Hi everyone, my name is Whitney and I'm a dental hygienist. If you're new here, welcome. If you've been here before, welcome back. Let's talk about what happens at the dentist when you're getting a deep cleaning. So we're talking about the deep cleaning procedure. Deep cleanings, also known as SRP or scaling and root planing, generally will take 2 appointments to complete. You will be numb, either by a thick, viscous gel that they can place all over your gums, as well as below the gums into the pockets. Some patients choose this because they don't like needles, but keep in mind you won't be entirely numb with the gel, but it does take the edge off. If you choose to be entirely numb, they can use local anesthetic. The shot. Now, most dental offices will give you topical gel on the area prior to the injection, so you'll barely feel the poke. If you're not sure which one to get, the numbing gel or the numbing local anesthetic, your dentist or your dental hygienist will recommend which one they believe is best for you, based on how deep your perio pockets are and the amount of buildup on your teeth. Now, the reason it does take 2 appointments to complete a deep cleaning is because they will numb up one side of your mouth at a time. We don't want your full mouth to be 100% numb when you leave the appointment because it lasts a couple hours. So trying to talk and to not bite up your cheeks would be super difficult if you're 100% numb. So the right side of your mouth is one appointment and the left side of your mouth is the other appointment. Between the 2 front teeth on the top and the bottom is where we determine the right versus the left. Say your first appointment was to start on your right side. It would be all your top teeth on the right and all your bottom teeth on the right. Then after the first side of your mouth is complete, you'll come back on another day. It can even be the next day if that works with everyone's schedule, but you'll come back relatively soon to do the exact same thing on the other side of your mouth. Now, if you're curious as to exactly what's happening during the deep cleaning once you're all numbed up, the process is very similar to a regular cleaning, except they are cleaning below your gum line as well as the tops of your teeth. Now, of course, you'll be numb, so you won't really notice the difference. If you weren't numb, you would definitely feel the difference. Regardless, you might feel pressure when you're numb, like you might recognize which area they're at, but you shouldn't feel any pain, and if you do, let them know so they can give you more numbing. The next question I always get is, will there be bleeding? And the answer is yes. During the procedure, yes. But it stops very quickly, right when the dental instruments are out of your mouth. So once you're done with the deep cleaning, you go home and you go about your regular life again. It's not a big deal like a tooth extraction or anything. With extractions, you need gauze in your mouth for the day, you need a rest for the rest of the day. No, for a deep cleaning, none of that. The bleeding stops right away and you can go about your regular day and brush and floss like normal. You don't have to baby your mouth at all after a deep cleaning because home care, brushing and flossing, is key and so important after a deep cleaning. You always want to keep those gum pockets clean so they can firm up and not allow any tartar to start building up in those areas again. Oftentimes, water flossers are super recommended for anyone who's had a deep cleaning because again, home care is so important after deep cleanings and you want to keep those areas clean. Sorry if I just said that twice. It's okay, I'll say it again. Home care is one of the most important things for the success of your deep cleaning. One more thing about bleeding during the procedure is that I want you to rest assured there will be lots of water and suctioning throughout the appointment so you won't be tasting blood. Now, after side 1 is deep cleaned and side 2 is deep cleaned, the next appointment is generally a 4 to 6 week re-evaluation appointment. So at this appointment, they will recheck the probing measurements. So they will perio chart and compare your numbers to before your cleaning was completed. The goal is that the numbers have improved. Your gums have firmed up and healed up, and now they have a baseline of numbers in your chart to recheck at your routine cleaning appointments. You will also have a regular cleaning done on this day as well. If there are any areas of residual tartar, they will get in there and clean them off. It's usually not uncomfortable at this appointment, so you won't need to be numb. But if there are any localized areas of tartar that are super difficult to remove for whatever reason, they will definitely accommodate you and make you comfortable if, say, you need a little bit of that numbing gel in a couple of the areas. After this cleaning, again, we're talking about this 4 to 6 week re-eval appointment cleaning, they will polish and remove any stain and make sure you feel cosmetically good and fresh. And lastly, they will determine your recare frequency, meaning how often you should come in to get regular cleanings. Usually more often than 6 months, so the tartar won't build up again. Usually for the first year after a deep cleaning, we like to see you every 3 months. We will oftentimes re-evaluate after 1 year to see if you're okay to graduate to every 4 months or even every 6 months. Please keep in mind that every individual patient is different. There is not a one-size-fits-all to this recare frequency after a deep cleaning question because some patients have severe periodontal disease and it won't be simple. They may need to be referred to a dental specialist to help treat their gums and may always be on 3-month recare. years. However, some patients may have only needed a deep cleaning because it's been years and years and years since they've been to the dentist. And they are young and healthy, and it was fairly simple to bring their gums back to health, and now they are good with every 6 months. Those are two extreme examples, and there's a million different variables and different cases in between. So my advice to you is to find a good dental office that you trust and a dental team that will explain your situation to you. I hope this video helped you. Please like and subscribe if it did. Let me know in the comments below if you're interested in watching a full deep cleaning procedure. I had a couple clips in this one like you saw, but if you want the full thing, let me know. I also have more information about all things dental hygiene on my website, teethtalkgirl.com, if you want to learn more about healthy mouths and healthy teeth. Until next time, peace, love, and teeth.